Hi, my name is Rick Olderman. I'm a physical therapist and somatics practitioner, and I'm talking to you about hypermobility. What should we do about this? Well, there are different names for hypermobility, and you could have hypermobility syndrome, you could have Marfan syndrome, ehlers-danlos. All of these have as one of their highlights a hypermobility issue, which just means that your joints are a little too loose, your ligaments are too loose, and they're not controlling things well. Here's what it kind of looks like. If you are able to do, bending your thumb down to your wrist, or your elbows can bend backwards, or your knees can bend backwards. Well, these are joints that shouldn't be doing this, and it would indicate that your ligaments aren't providing the necessary stability to prevent this from happening. Now, I just want to point out, you can see this girl's elbows bend way back. If yours bend back at all, they don't have to bend back this far in order to be hypermobile. This is really extreme. And this person, they can touch their thumb to their forearm, but if your thumb doesn't quite touch your forearm, it doesn't mean that you're not hypermobile. So it's important to understand that everything in the body is a spectrum. So generally, most of you will know, if you're even watching this, you probably already suspect that you are hypermobile because your joints are just very loose. If you believe that your joints are very loose, then this video is for you. Now, why is this so important? Well, ligaments are our first line of defense in terms of joint stability. When we move, it's the ligaments that are guiding the joints and keeping everything in line. When we don't have that, then things get a little sloppy. Now, you might think, well, I have muscles, but the muscles fire way too late in order to control things. But nevertheless, strengthening is important if you have hypermobility syndrome, and that will probably be your focus of the program here. But if you are going to strengthen, I recommend that you strengthen just within 50 to 75% of your normal range of motion, because your normal range of motion is excessive. So you must shorten it in order to get, and you will get the benefits of the strengthening even if you don't move through the full range of motion. So just keep that in mind. While stretching feels good, because you're hypermobile, likely you don't need stretching, but it feels good to do. So I want you to focus on just the stretches that show a deficit in your length. So if something is truly short, then you can stretch it. Otherwise, if you continue stretching, you're contributing to the issue. Well, where do I go from here? Well, you can go to fixingyou.com and visit the top tests and tips and get started on understanding and fixing your pain. You can also go to fixingyou.com and join the interactive online clinic and finally solve all of these systemic issues that are creating your pain. Regardless, I want to thank you for watching this video, and I hope to see you at the Fixing You Interactive Online Clinic. Thanks.